Assalamualaikum beta. In this video lecture, I will deliver the lecture on basal cell carcinoma. Okay. Previously, I have recorded the lectures on squamous cell carcinoma, that is also malignant skin cancer. By the way, basal cell carcinoma is number one. It is most common invasive cancer of the skin. Don't forget, remember this point. Squamous cell carcinoma, I mentioned in the previous video that squamous cell carcinoma is at number 2 in the list. But basal cell carcinoma, BCC, it is most common invasive cancer of the skin. Okay. It is locally aggressive. Yeah, as you can read, it is very much aggressive locally at the place where it is, okay, in the skin, and it is slowly growing. It is, by the way, locally aggressive. It is locally aggressive, slowly growing, and it rarely metastasize. Okay, even less than 0.5% it metastasize. Okay, it is locally aggressive. It is aggressive at the site where it is present. Okay, yeah. And the vast majority of the basal cell carcinoma, they are diagnosed at the early stages. Why? Because it is slowly growing. So you can, diagnose it at early stages and you can cure it. Okay, and it is cured. It is cured by local excision. Okay. Yeah, this is how you deal with it. Where does it appear on the skin? It loves to appear on the skin where there is exposure to sun. So it appears on the sun exposed sites, especially in lightly pigmented elderly adults, जिनकी थोड़ी fair skin होती है. Lightly pigmented जो लोग होते हैं, elderly adults, उनके अंदर बेटा सन एक्सपोज साइट्स पे ये होता है. ठीक है. और ख़ास करके इंसिडेंस बीसीसी डेवलप करने का उन लोगों में हाई होता है जो इम्यूनो कंप्रोमाइज्ड होते हैं, या फिर उनके अंदर एक डिसऑर्डर होता है जिसमें डीएनए रिपेयर सही से नहीं हो पाती, जिनके अंदर डीएनए रिपेयर जो है वो डिसऑर्डर्ड होती है, और दैट डिजीज़ इज नन अदर देन ज़ीरोडर्मा पिगमेंटोसम, एक्सपी. ओके, XP, xeroderma pigmentosum, is the condition in which the repair of the DNA is disordered. Okay, this is one of the conditions, and this immunosuppression is number 2 condition. And these two are the conditions, being immunocompromised and having this condition. These are two very important and very common risks that can lead to the development of basal cell carcinoma. Okay, now I will tell you into details of this carcinoma. That includes number 1, nevoid basal cell carcinoma syndrome, nevoid BCC syndrome. What is this? This nevoid BCC syndrome, basal cell carcinoma syndrome, also called basal cell nevus or Gorlin syndrome. Basal cell nevus or Gorlin syndrome, it is a syndrome in which multiple things you will see happening in the body, and out of those so many things, one thing that is you have to see is basal cell carcinoma. Okay, so nevoid basal cell carcinoma syndrome is a condition in which so many things you will come to see happening into your body, but one thing is development of this malignant condition, basal cell carcinoma. Okay, इट इज़ बाय द वे एन ऑटोसोमल डोमिनेंट डिसऑर्डर, जिसमें क्या क्या होता है मैं आपको बताता हूँ. एक तो चीज़ जो होती है वो है कि बेजल सेल कार्सिनोमा डेवलप होता है खास करके बिफोर 20 ईयर्स, राइट. और जो दूसरी कंडीशंस इस नेवॉइड बेजल सेल कार्सिनोमा सिंड्रोम में होती हैं, जैसे दूसरे ट्यूमर्स का बनना, जैसे मेडलोब्लास्टोमा, ये ब्रेन का ट्यूमर है, और इसके अलावा ओवेरियन फाइब्रोमा, और उसके अलावा कुछ और कंडीशंस हैं जैसे कि ओडोंटोजेनिक केराटोसिस्ट गम्स में, या फिर जिंगिवल मिकोजा में केराटोसिस्ट का बनना. मैं क्विकली दिखा भी दूँ ओडोंटोजेनिक केराटोसिस्ट कैसे होते हैं. कैन यू सी इन द मिकोजा द लार्ज बिग सिस्ट, दिस इज़ द बिग ओडोंटोजेनिक केराटोसिस्ट. ओके, एंड इसके अलावा जो है बेटा पाम्स और जो सोल्स है ना, उसमें पिट्स का बनना. पिट्स बड़े विजिबल नहीं होते, लेकिन जब आप स्किन को बहुत ज़्यादा मैग्नीफाई करके देखेंगे तो आपको ये कुछ पिट्स नज़र आएंगे. ठीक है. और इसके अलावा कुछ डेवलपमेंटल एबनॉर्मलिटीज़, खास करके बोन्स की डेवलपमेंटल एबनॉर्मलिटीज़. तो बेटा नेवॉइड बेजल सेल कार्सिनोमा सिंड्रोम एक ऑटोसोमल डोमिनेंट डिसऑर्डर है, जिसमें इतनी लंबी लिस्ट है डिजीज़ की जो होती हैं एक्चुअली, और उनमें से हमारा जो पर्पज़ है वो इसको स्टडी करना है, बेजल सेल कार्सिनोमा को. ठीक है. वाई डू पीपल डेवलप बेजल सेल कार्सिनोमा? मैंने आपको रिस्क फैक्टर ज़रूर बताए कि इंसिडेंस इन लोगों में हाई होता है, लेकिन व्हाट इज़ द एग्जैक्ट पैथोजेनेसिस? इफ़ आई एम द वन, if I want to develop basal cell carcinoma, then what should be the changes in my body to develop basal cell carcinoma? There we go with the pathogenesis. Okay, there we go. This is what I need to do. Germline loss of function mutation in one PTCH allele. Like you have homologous pair of chromosomes. Okay, इस पे एक PTCH जीन मौजूद होता है, एक PTCH जीन इस पे मौजूद होता है, एक मैटरनल होता है, एक पैटर्नल होता है, ठीक है। जो एक अलील है उसमें तो जर्म लाइन लॉस ऑफ फंक्शन म्यूटेशन हो जाती है, ठीक है, जर्म लाइन यानी कि हेरिडिटरी। एंड द सेकंड नॉर्मल अलील इज इनएक्टिवेटेड बाय म्यूटेशंस acquired due to exposure to UV light in the sun rays. Okay, so the mutation in this one PTCH gene, in this one PTCH allele, the loss of function mutations in this one allele are due to hereditary, due to germline mutations. And this second allele was normal actually, but later in the life this is also mutated due to exposure to sunlight, UV rays in the sunlight, chronic exposure. So when these both the PTCH genes are lost, when both these PTCH genes are lost, what is going to happen? There will be a series of reactions which you will see, and at the end of those reactions you will develop basal cell carcinoma. So let's talk about this mutation and ultimately developing basal cell carcinoma. Okay, let me take you into the detailed parts of the lecture very quickly. Now I will here explain you the pathogenesis of the lecture in a better way. Okay, yeah, there we go. Okay, you need to first understand the normal mechanism. I will then take you to see, look how this PTCH is mutated and how this is happening then. Normally the PTCH protein, what does it do? Let me tell you. Normally PTCH protein is attached with another transmembrane protein, that is smoothened protein, green colored protein. Okay, by the way, whatever I am discussing is in the especially in the basal cells of the epidermis. If I repeat again, that this is your epidermis. Okay, this is epidermis and this part is dermis. ठीक है, एपिडर्मिस की जो सबसे नीचे वाली लेयर होती है इसको हम बेजल लेयर कहते हैं, ठीक है। इस बेजल लेयर के अंदर जो सेल्स होते हैं ना, उसके अंदर उससे ओरिजिनेट होता है आपका बेजल सेल कार्सिनोमा. सो व्हाट एवर आई एम डिस्कसिंग इज हैपनिंग इन द cells in the basal layer. Okay, so normally what happens that PTCH protein is attached to smoothened protein. Okay, and whenever sonic hedgehog SHH binds to this PTCH protein, they two get separated. Look, when SHH is bound with this PTCH, smoothened is separated. When this signal SHH is not there, they two are attached together. Okay, they two are attached together when there is no signaling. But when this SHH binds with PTCH protein, they two get separated. Okay, once they two are separated, this green protein SMO protein does what? Ligand independent signal transduction. एक बार इसने SHH ने इसको एक्टिवेट कर दिया तो ये अलग हो गई. अब ये बगैर लाइगेंड के खुद ब खुद सिग्नल ट्रांसडक्शन करती रहेगी और इट विल इंक्रीज द production of a very important transcription factor, that is GLI1 transcription factor. Okay, and this transcription factor, you know beta, what is this transcription factor GLI1 going to do? It will increase the gene expression. It will increase the gene expression in the basal cells of the basal layer, लीडिंग टू द नॉर्मल डेवलपमेंट एंड द टिश्यू होम्योस्टेसिस. सेल्स ग्रो करते हैं, मल्टीप्लाई करते हैं और जब वो मल्टीप्लाई कर चुके होते हैं तो फिर क्या होता है बेटा, जब वो मल्टीप्लाई कर चुके होते हैं तो फिर ये सिग्नल्स SHH यहाँ से हट जाता है. जब ये SHH का सिग्नल यहाँ से हट जाएगा तो ये दोनों प्रोटीन्स आपस में फ्यूज़ हो जाएंगी. जब ये फ्यूज़ हो जाएंगी तो फिर ये लाइगेंड इंडिपेंडेंट सिग्नल ट्रांसडक्शन नहीं होगी, मज़ीद ट्रांसक्रिप्शन फैक्टर नहीं बनेगा, और मज़ीद ट्रांसक्रिप्शन फैक्टर नहीं बनेगा तो सेल्स की मज़ीद मल्टीप्लिकेशन और ग्रोथ नहीं होगी, वो रुक जाएगी. ओके, लेकिन आप फ़र्ज़ करें कि अभी ये जो आपका PTCH है वो म्यूटेटेड हो गया है. जो जीन PTCH प्रोटीन बना रहा था उस जीन में म्यूटेशन हो गई. अब उस जीन में म्यूटेशन की वजह से बेटा जो प्रोटीन बनी है वो भी ज़ाहिर म्यूटेटेड होगी. सो दिस एबनॉर्मल म्यूटेटेड PTCH protein, due to loss of function mutation in PTCH gene, what happens is this is mutated now. And what does it do? Without any signal, without any SHH molecule, it is now activated every time. Okay, this is the mutation or abnormality that have occurred. That normally what happens, that PTCH protein only gets activated when there is SHH molecule, but now you can see it is activated by itself without any signal. So there is no signal, so there is continuous activation of the PTCH protein. When this is continuously activated without any signal, by the way, so this SMO, is separated all the times, and it will keep on doing the continuous ligand independent signal transduction. Okay, that was happening here, ligand independent signal transduction. But in this case, ligand independent signal transduction was for certain period of time, जब तक ये एस एच एच मॉलिक्यूल यहाँ पे लगा हुआ था, तब तक ये सिग्नल ट्रांसडक्शन हो रही थी. जब ये मॉलिक्यूल हट जाता था तो ये दोनों प्रोटीन फ्यूज हो जाती थी और ये मजीद पाथवे इंक्रीज नहीं होता था. लेकिन अब क्योंकि बेटा म्यूटेशन हो गई है, तो इसकी वजह से क्या हो रहा है, बगैर इस मॉलिक्यूल के, इंडिपेंडेंट ऑफ दिस मॉलिक्यूल, दे टू आर नाउ सेपरेटेड एंड दिस प्रोटीन इज कंटिन्यूसली डूइंग व्हाट, कॉन्टीन्यूस लाइगेंड इंडिपेंडेंट सिग्नल ट्रांसडक्शन. तो हर वक्त आपका ये ट्रांसक्रिप्शन फैक्टर GLI इंक्रीज रहेगा और देयर विल बी अनरेगुलेटेड एंड अनकंट्रोल्ड डिवीजन ऑफ द सेल and abnormal growth of the cell leading to development of basal cell carcinoma. Okay, and with some bony abnormalities of the vertebra and the ribs. Yeah, the same mutations are seen in hereditary case and the sporadic forms as well. Hope you are clear with the pathogenesis of beta basal cell carcinoma, right? Okay, I will now take you to morphology part of basal cell carcinoma. Okay, few things I need to show grossly. How does it appear, beta? If somebody is suffering from basal cell carcinoma, then how does it appear on the skin grossly? There are pearly papules which appear on the skin. On the skin, what appears? Pearl-like papules. Yeah, pearl-like papules containing prominent डायलेटेड सब एपिडर्मल ब्लड वेजल्स, जिसको हम टेलेंजिक्टेसिया भी कहते हैं क्योंकि वो एक स्पाइडर शेप में होती हैं. मैं कहने का मकसद ये है बेटा कि इफ़ समबडी इज सफरिंग फ्रॉम बेसल सेल कार्सिनोमा, देन व्हाट लेजन अपीयर्स ऑन हिज और हर स्किन, दैट इज़ पर्ली पेप्यूल्स. और इस पेप्यूल के अंदर से आपको डायलेटेड ब्लड वेजल्स दिखाई देंगी सब एपिडर्मल इन द टेलेंजिक्टेसियस पैटर्न. आई एम लाइक, okay, I need to show you this lesion. So to have a better understanding, there we go. Can you see this pearl-like papule? And if I zoom into this picture, you will see some prominent dilated blood vessels coming out. Okay, prominent dilated blood vessels coming out in the spider web like pattern. Okay, so this is giving pattern of telangiectasia. These are very much dilated blood vessels in the subepidermis. Okay, this is early lesion. But if let's suppose this lesion, if it gets advanced, it will keep on ulcerating the skin, it will keep on dipping and digging into the skin, and it will this is the early lesion, and if it keep on ulcerating the skin, it will get worse, and it will start invading into the underlying bone, or if it is on the face, then it will invade into the facial sinuses. Okay, and once it has ulcerated and have entered into the bone and the facial sinuses, it looks like this. This is a big ulcer on the skin. Okay, just a second. This is the big ulcer on the skin. This is the big ulcer on the skin called rodent ulcer. Okay, initially how was it? Initially it was like this. This is early lesion. These are pearly papules. If it starts ulcerating into the skin, it will form like this. This is the later stage, advanced stage, when the lesion has invaded down, when the cancer has invaded down into the bone and the facial sinuses. This is how it looks. It is called rodent ulcer. Okay, yeah, that's it, beta. Now, but there is one variant of the basal cell carcinoma which I will surely mention, that is a little different from typical typical basal cell carcinoma. One variant, that is superficial basal cell carcinoma. Superficial basal cell carcinoma, it resembles more like melanoma. It doesn't present like present like pearly papule having superficial blood vessels. It presents a little differently. It appears as a erythematous plaque. Okay, resembling the early forms of melanoma. Now let me show you the gross appearance of this superficial type of the basal cell carcinoma. Let me quickly show you. Superficial variety of the basal cell carcinoma. It is like this. Can you see, beta? This is the erythematous plaque, and it appears on the skin in case of superficial basal cell carcinoma. But don't forget, this is not the typical basal cell carcinoma. Typical basal cell carcinoma looks like this, the pearly papule having blood vessels coming out. Okay, and if it gets deeper into the bone and the facial sinuses, the rodent ulcers are formed like this. Okay, these are very much ulcerative. And one variant of the basal cell carcinoma that I told you is this superficial basal cell carcinoma. It is resembling early forms of melanoma, and this is not a pearly papule. However, it is a erythematous patch or plaque. Okay, so this is about the gross appearance of basal cell carcinoma, beta. Okay, now some microscopic features I will tell you. Yeah, microscopic features of the basal cell carcinoma, right? That the tumor cells in the basal cell carcinoma, they obviously originate from the basal cell layer because it is basal cell carcinoma. But don't forget, they may also originate, in some rare instances, they may originate from follicular epithelium. That is the epithelium of the hair follicle. Don't forget. Do note it in your points. Okay. By the way, basal cell carcinoma does not arise from mucosal surfaces. However, squamous cell carcinoma does. Okay. There are two histologic patterns of the basal cell carcinoma under microscope. One is multifocal growth pattern, one is nodular lesion. Multifocal growth pattern is very much superficial. It extends on the surface of the skin. However, nodular lesion does not extend on the surface. However, it grows deeply downward into the dermis like islands of the cells. Okay, let me show you two types very quickly. Multifocal growth and nodular lesion. There we go. Can you guess what type is this? Is it multifocal or it is nodular lesion? What type is this, beta? This is multifocal growth. Why is it multifocal? Because the characteristic of multifocal growth of basal cell carcinoma is to extend over the surface, few millimeters like this. It is going this way and it is not extending down into the dermis. However, you will see another histologic pattern that is, getting down. This entire is epidermis. Below is dermis. Okay, and can you see the cells have come down very much deeper, all the ways down. Okay, this is beta nodular lesion, and the cells are growing like islands or the cords. And one very important thing that I have to show you in this nodular variety, I don't think this is a really good, kind of focus, but yeah. One thing that the cells are arranged at the periphery of this nodular lesion. This is the periphery of the lesion. Let me show you. This is the periphery of the lesion. Okay, this is the periphery of the lesion, and in this periphery of the lesion, the cells are arranged in the long axis, very much closer to each other and parallel to each other. They are parallel to each other at the periphery. In the center, they might be, very much dispersed, but at the periphery of this lesion, they are arranged in the palisading fashion. That is, in the long axis, they are parallel to each other like this. Okay, if this is, the cells are coming like this, then at the center, they, may be like very much dispersed. But in the periphery, they are very much parallel to each other in the long axis at the periphery. This is called palisading fashion, in which the cells are present in, parallel fashion to each other. Okay, at the periphery. Right, this is the palisading fashion. Okay. Right, one more thing that I have to show you in this nodular variety, that, okay, during sectioning, if let's suppose on my skin I am developing basal cell carcinoma, and if I take a biopsy from here, while taking section of this particular piece, what happens? The stroma of the skin gets a little separated from the skin. Okay, During sectioning, stroma retracts away from the carcinoma. This entire is the carcinoma of the skin. Okay, basal cell carcinoma, and this entire is stroma of the skin. जब आप सेक्शन करते हो ना बेटा स्किन का, जाहिर है इसको स्टडी करने के लिए, तो उसके दौरान क्या होता है, स्ट्रोमा इससे सेपरेट हो जाती है थोड़ा सा, जिसकी वजह से बीच में एक स्पेस बन जाती है। इसको हम कहते हैं सेपरेशन आर्टिफैक्ट। इसको हम क्या कहते हैं, सेपरेशन आर्टिफैक्ट कहते हैं। ओके, it is the point that actually differentiate basal cell carcinoma from trichoepithelioma. This is the thing that does not occur in case of trichoepithelioma. ओके, एंड इसको हम आर्टिफैक्ट क्यों कहते हैं, क्योंकि हमने इसको क्रिएट किया है ना, ये वैसे तो नहीं था। हम जब सेक्शन ले रहे थे, स्लाइस ले रहे थे, तो उस वक्त ये स्ट्रोमा इससे सेपरेट हो गई आपके कैंसर से, जिसकी वजह से ये एक बीच में आर्टिफैक्ट एक क्रिएट हो गया, स्पेस क्रिएट हो गई, जिसको हम बेटा सेपरेशन आर्टिफैक्ट कहते हैं। ओके, या and okay, this is all about beta this lecture on basal cell carcinoma. If you really like it, you got your concepts clear, you can appreciate me by subscribing to the lecture and liking to the video. Thank you so much beta. Class dismissed.